Welcome back to Product and Health Tech, a community for health tech product leaders by product leaders. I'm Chris Hoyd, a principal at Vinyl, which is a product development firm focused on health tech. Today, we're looking at an angle of health tech that we haven't really explored before. Rather than focusing on the way technology impacts more traditional healthcare, like care delivery or population health, today we're taking a look at health tech in the context of intense athletic performance, specifically for professional soccer. To dive into this, I spoke with Chris Shenberger, head of sports science and medicine at Columbus Crew SC. Chris had some fascinating things to share about how data-driven professional sports have become, how personalized athletes' training regimens are now, and how precise it allows his department to be, optimizing for things like recovery time, anticipating illness, and even catering players' strength to various team structures and playing styles. Let's jump into the conversation. Chris, so talk to us about how technology has transformed the way you monitor and track player performance and health.
Yeah, sure. It's a great question. I've been in Columbus now for 8 years, and over the course of those 8 years, there's been more and more technology, right? That's kind of come out and at our fingertips, in terms of being able to track players, right? There's so much, right? We have so many data points at this point that it's really now about figuring out what's important, right? Like, what are the important data points and why are they important? But it's truly transformed the way we're able to understand the individual, understand the system or the style that we play. I think about 3 coaching staffs that I've had in my time here, and each has had a little bit of a different style that they play. And we've been able to use, right, the technology that we have to understand the style that each plays and how the players that we have fit our system, how we can make them perform better, how we can determine if it's a player that fits in our system or doesn't fit in our system. And then even furthermore down into our reserve team and our youth academy, do we have players in those systems that fit those profiles based on the data that we've collected and the ability to understand, right, what it takes to play at this level. So.
Wow. Okay, so you took that in a direction that is way more interesting than I was even expecting. So you're like essentially matching sort of biometrics or indications of strength and fitness to a playing style. That's really cool. Can you say a little more about that?
Yeah, and so we're able, for example, the GPS data that we collect, we're able to create kind of physical profiles of what it takes to be a center back in our system here in Columbus, or what it takes to be a striker, right? What it takes to be Cucho in our system and be successful. And we're able to then take that and say, okay, internally, do we have someone within our system, whether it's at the reserve team level or the youth academy, that we feel like fits that profile physically, right? And then you take that even in a step further into the gym, where we're using velocity-based training now, right? So we can take a look at how fast guys are moving weights. We are looking at, we have a bunch of different products from the company Vault, where we're able to look at eccentric hamstring strength. We're able to look at adductor strength. There's all these different variables, force plates, right? How high are they jumping? How quickly are they able to land and jump again? All these things create this large profile in which we're able to say, okay, these guys are successful. What does their profile look like? Now, how can we find the next version of that person? And if it's not internal, even right externally, going out and recruiting players that fit the profile of what we're looking in that specific instance.
Okay, so that's like incredibly sophisticated. It sounds like there's data science, all kinds of disciplines that must be involved in determining those things.
Yeah, it's really a team of people, right? Not just in the performance world, right? Like I have a staff on the first team of 9 other individuals in the performance and medical world. And then we have a separate staff that works with our reserve team, and another performance staff that works with our academy, right? But we're all looped in together. And then outside of that, a director of analytics who truly doesn't even touch the performance side at this point. He's all on the technical, tactical side. We've got a staff under him that's recruiting, scouting, right? All those sorts of things. So that entire group all really plays a part in it.
That's super cool. So do you have a sense of where the crew sort of fits in the broader scheme of things in the league? Like, are you guys, pushing the analytics and data even more than other teams, or do you think it's sort of, it's so competitive, everyone's doing it?
Yeah, that's an interesting question. I would say that we're probably not doing anything that other clubs aren't doing. What I think we do really well is getting everyone on board with moving in the same direction, understanding what the important data points are, and then being able to broadcast that across the club. So we started a movement here probably about 2.5 years ago that we call One Club. And the vision is that from our U13 Academy players through our first team players and staff as well, everybody's working towards the same goals, the same mission, the same vision.
With all that data and sort of the precision you're driving towards in terms of certain characteristics, even for different positions, do you guys create like personalized sort of training plans for each player?
If you take it down to that level, right, we've created these profiles that say in this specific position, we feel a maximal effort in total distance or a maximal effort in sprint distance for, you could say, worst case scenario, right? In a particular game, this person needs to be able to run 12K in this position. It doesn't mean they're going to do it every game, but we feel like that's kind of the max effort that they'd have to give in any particular situation in a game. And so we're able to then take that information and build programming at an individual level to ensure that players in those roles are going to be able to achieve that if asked to do it in a game. It's interesting because we have a handful of players who play multiple positions, and there might be one particular position where on any given game day maybe they're only going to sprint 60 meters. But then we switch them into, for example, a wingback position where they might be asked to sprint 500 meters, right? And so if you haven't built the programming individually and appropriately for that person to be able to do the 500 meters, right, we're increasing the risk exponentially to then say, okay, we need you to go play this position, but we haven't actually built you to be able to do it. All right. And so we use that, we look at that daily, weekly as a group to ensure that we're checking as many boxes as we can in terms of what we're asking the guys to potentially have to be able to do, to be able to comfortably go to the coach and say, hey, yeah, we think he can do it. And, the level of risk is whatever, right? Low, hopefully.
Interesting. So the player has you kind of serve as a liaison or a representative almost of like how you've crafted their physical abilities in terms of what the coach is asking for. Okay, so let's talk a little bit now about sort of the technology that the players interact with. Is it, I imagine it's evolved quite a bit over the last 8 years since you started. Can you talk a little bit about whether it's wearables or maybe getting into sleep tracking or any of that stuff that the players?
Yeah, sure. So, the big, they can interact with as much of this stuff as you want to give them, right? But I think that's also a really key piece, is to give them the right pieces of information and teach them the why we're giving it to them, right? Because we could give them all this. Our GPS trackers, for example, track thousands, right, of metrics, thousands of data points, but they don't all make sense for each individual. So, the ones that we use most here are a handful of metrics within the GPS, so the physical metrics that we collect on field. We, for 3 years now, have been using Oura rings pretty regularly. We probably have 75% of the team that wears an Oura ring. We have a handful of guys that prefer Whoop, so they wear the Whoop instead of the Oura ring. But yeah, we collect all that information, right? And we It's a tricky one because the players, for example, are like, well, I don't want you to know what time I went to sleep. I don't want you to know how many hours of sleep I got. But we've done a lot on the front end to educate them. For us, it's, do we want you to get enough sleep? Absolutely. But I'm not concerned that on a night after a game, you didn't go to sleep till 2 a.m. The adrenaline, all those things, right? It's hard to go to sleep. What we're more concerned about is looking at patterns, right? Do you have a pattern of consistently getting less sleep? We look at heart rate variability quite a bit with the Oura Ring. So are there patterns of change within your heart rate variability that maybe are telling us something like you're getting sick, you're not recovering as well? And so those have been, I think really vital pieces of information that we've been able to pull in and add to our database, and kind of further allowing us to individualize programming for these guys.
Does anything, any moments or stories stand out from the last couple of years where, like you said, maybe you've been able to anticipate that someone had the flu coming or something, and you were able to inform the coaching staff to, adjust the roster in a certain way?
Yeah, sure. Unfortunately, I would say we haven't had any instances where we've caught something, but we've seen themes where after the fact, you go back and look and you're like, oh, yep, there it was. They had a big drop in their HRV, and they came in the next day and they weren't feeling well. So I would say probably still in its infancy in terms of us truly being able to understand and be proactive in our approach as it relates to that data.
If you could only pick one piece of sort of equipment or wearable or piece of technology for the players to lean on for you to track their overall health, what would you pick?
This is gonna sound crazy probably, but for me, it's just a simple wellness questionnaire. It's subjective, right? But for me, we learn so much from that. I've got a player who, no matter how hard he trained the day before, no matter how much he did in a game, he's a 5 in energy every day. He's a 5, and it's a scale of 1 to 5. 5 is 3 is your average. 5 is like you're better than your average. 1 is you're no good. He's a 5 every day, no matter what, in energy, soreness, nutrition quality, across the board. But for me, it's a piece of information that we learn a lot about the person. And so he's a 5 every day. If he puts a 3 for something, for me, that's a flag, right? Like, okay, what's going on with this guy? And then we can start to dig into, do we see something in the GPS data that we're collecting? Do we see something in his jumps on the force plates? Do we see something? Is he not moving the weight as fast with the VBT system, right? It kind of, for me, is the first step. And okay, now we start to dig into things and see what else we're finding.
At this point, many international players have come through MLS, right? From all over the world that played for the Crew or other teams in the MLS. I went to the MLS All-Star game in 2015. The All-Stars played Manchester United. And back then, it looked like there were sort of almost visible differences in the level of like fitness and strength, and maybe even different focus areas. So I'm curious if you ever sort of noticed that or picked up on that, or maybe like if now there's so much data and technology involved, maybe that's normalizing a little bit. But just curious if you have any thoughts on that.
Yeah, I think to your point, there's so much data out there now that it's probably normalizing some. For example, for us, again, I mentioned earlier, but the ability to build a profile within the style that we want to play allows us to kind of maximize the strength and fitness of each player, right, based on what we want them to do. I talked a little bit about the velocity-based training system. We use a brand called eNode, right? But we can take the same exercise with 3 different players and get a different result from it, right? If it's a player that we're trying to build more speed, if it's a player that we're trying to build pure max strength, if it's a player that we need more endurance, right? We can take the exact same exercise and say, okay, we need you to move it at this particular speed in order to achieve this result. And then we can load the weight onto it to make sure that they're moving at that specific speed, right? So I think at some level, we're able to start to normalize some of that now.
Yeah, that's really cool. Is there any tension between like the head coach, the manager, and how, that maybe they have a traditional approach to training, and your department's bringing all this data and precision? Have you found maybe with the different coaches you've worked with, are some more receptive than others to the sort of data-led approach?
Yeah, I've been pretty lucky in my time to have, three coaches who I think have been, in their own respects, in their own ways, pretty open and receptive to it. Um, at the end of the day, it's the data is a small piece to the bigger puzzle, right? And so it's on us that are working in the performance space with the technology to be able to make the coach understand the value in it, and to present it to them in a way that they find it valuable, and want to use it in terms of the way they're training, right? So I've had coaches who have been like, I want you to give me projected loads for a session every day, and I want you to get my attention and tell me in the middle of a drill if we're starting to go over. I've had coaches who want some level of periodization, but then they want you to back off, and they're gonna do what they're gonna do on the field, and sometimes it's gonna be less, sometimes it's gonna be more. But what I've learned is they're all pretty good at without you reminding them on field where they're at, they have a pretty good understanding of where they're at. Also, I like to think of the data in terms of working with the coaching staffs is we're really providing them a framework to work within, right? Whether it's a recommendation about what the microcycle periodization looks like for the week, or a particular player who we're seeing a trend in, like, man, this guy's not covering as much ground. He's not moving weight as fast as he normally does, or his wellness questionnaire, he's coming in with a 2 soreness 3 days in a row, and that's not typical for him. That's all information that we relay to the coach, and then ultimately the coach is going to make a decision off of it. But it's really a framework for them to make better and more informed decisions.
Interesting. Have you found, maybe over the course of your tenure, are players receptive to this? Are they really interested in this, or does it feel like it's infringing on their,
Yeah, I would say, I would say probably even 5 years ago, I would have told you, yeah, it's a battle to get them to do these things. We're pretty lucky here, but again, I think it goes back to the education piece. We do a really good job of educating on the front end of the why, and so we tend to you have, it's cultural, right? So there's certainly players from certain regions who maybe aren't as accustomed to it, or don't like it, but we don't tend to have any issues currently in terms of guys wanting to wear, for example, so the players are a part of a players union, right? So they have a collective bargaining agreement with the league. One of the things that we are not allowed to do is require them to wear the GPS pods in game. And probably 4 or 5 years ago, guys fought it quite a bit on the basis of, like, I don't want you to be able to use this information when I'm up for a new contract.
Whoa, interesting.
Right. So they're not going to pay me as much because I'm not covering as much ground as I was 3 years ago when I got this contract, right? Now it's not even like we just put their pods in there. They wear a little GPS bra. We put it in their locker. They throw it on and go out to the game. It's like, it's not even a question. But again, it goes back to, I think, where we're at in terms of the evolution of technology, the education that we've done on our end as to the why, right? Because if we miss the data in the game, trying to put together what did the week look like for them, did we overload them in a specific area, or are they underloaded, and we don't have the game data, it becomes really hard, right, to individualize a program to do the right thing for that player. And so, again, I think, and you start to see, you watch games on TV right now, they pop up and show you how far somebody's run or how fast they've run. And we've gotten to a point now with the guys where after a match, the day after a match here, we we have basically a dashboard that we built in Tableau that we cast up to a TV in the rooms in the gym and the athletic training room that basically just has all the loads for the players. How far did they run? How fast did they run? How much sprint distance? How many accelerations, decelerations? And they stand in there and they'll look at it for an hour and make jokes with each other if somebody didn't run as much as they thought they did, or.
So, Chris, I'm curious. The sort of buzzy topic in healthcare, health tech right now is AI. Are you seeing much of that in your world?
To be fair, not yet, but yeah, I think it's probably the next big thing that's coming our way. In fact, one of our owners has been on me about some buddies that he has that are in the AI tech world, and trying to connect us at some point. So, it's funny. I think AI is probably one of the next big things. I've been talking with a company that's doing like genetic testing at a level of taking the genetic testing with all of our physical data from the field, and trying to help us better understand at an even deeper genetic level how to individualize recovery for guys, right? So there's some really cool things on the horizon. At the same time, this stuff, right, you have to, again, there's so much of it out there. You have to filter what makes the most sense for you, as it relates to, do you have the manpower to manage it? Do you understand it? Is it cost effective, right?
You mentioned genetic testing. I think that's probably a good segue too. I'm curious what your take on the future of technology in your world might look like, and what it might enable for the team.
Yeah, I mean, I think it continues to go in a direction where we're going to be able to individualize these guys' programs at a level that you've never been able to, or probably could have even imagined that you could, right? I think about it a lot in terms of the recovery, because so much of the recovery becomes, some mobility on field, opening up their legs, taking them in to do some stretching and foam rolling, contrast bath, compression boots, things like that. But can we get to a level with the AI stuff that's out there and this genetic testing to where we can better understand, maybe contrast bath is good for 5 of the guys, but maybe these 2 guys actually it doesn't have the same impact with them. Maybe there's something else out there, a different recovery tool that we haven't thought of, or that we just don't utilize because we don't think it works, right? But then you start to get data that connects with the genetic testing and tells you, actually, for this guy, foam rolling is what he should be doing. He shouldn't be doing contrast bath, right? So I think it's pretty exciting to think that that could be on the horizon.
Okay, so what advice would you give to aspiring younger soccer players looking to leverage technology to improve their health and performance?
Yeah, I would say there's a ton of it out there. So probably to start, find somebody who knows what they're doing with it, and can help direct you towards what makes the most sense for you in terms of understanding you, first and foremost, right? Find the technology that helps understand who you are as a soccer player and an athlete. And then you can start to build on that in terms of, you see a lot of these things that are like, oh, this will help you become the next Mbappe or something like that, right? Like, for me, it's about finding the technology that helps you understand who you are first, and then you build from there.
Chris, thanks. This has been a fascinating conversation. You and I could probably talk at length about a lot of these things. Yeah. If any of our listeners or viewers have questions, how can they reach out to you?
If anybody wants to reach out and connect, probably finding me on LinkedIn would be the easiest way to do it.
Thanks so much for joining us. You can also connect with us on LinkedIn, YouTube, or on our website at productsandhealthtech.com. If you have ideas or suggestions on what you'd like to hear in a future episode, or if you'd like to be a guest, please just shoot us an email at info@productandhealthtech.com.